Sacred Heart Memorial Hospital in Portland opens at 6 in the morning, and Laura Bennett is always there by 5:47. The pediatric unit smells like antiseptic and floor wax under fluorescent lights that hum a frequency most people stop hearing after the first hour. She doesn't. Her ears caught that pitch in Baghdad, along with a lot of other things, the sound of rotor blades at 2 kilometers, the particular way Humvee doors close, the silence that comes right before. The silence she remembers most. She wipes down the medication charts with the same methodical rhythm she once used to field strip rifles, her movements economical, precise, nothing wasted. The scar tissue on her right forearm catches the overhead light when she reaches for patient files. It's been 6 years since she was told to disappear. 6 years since the woman she was died in a training accident on paper. The file still exists somewhere in a classified vault at the Pentagon. Senior Chief Petty Officer Laura Bennett. Killed in action, Kandahar Province. The official report is locked and redacted. The woman who carries this name now is someone different. Someone quieter. Someone no one is looking for. The pediatric ward at Sacred Heart runs like a functioning organism by 7 o'clock. 3 nurses, 2 residents, 1 attending who doesn't make eye contact with staff below his salary tier. Laura moves between patient rooms with the kind of focused presence that makes difficult children stop crying. She changes for lines with hands steady as surgical lasers, her touch careful but assured. A Navy dependent in Bay 4, 7-year-old with acute leukemia, father a junior officer stationed at Naval Base Kitsap, needs a new access port because the current line has infiltrated. Laura explains it to the child in terms he understands. No panic. No false comfort. Just clarity. She swabs his arm with alcohol, waits the 3 seconds for it to dry, slides the 22-gauge catheter in at the correct angle and depth, watches the blood flash in the hub. She secures it with tape that will hold for days. The entire procedure takes 90 seconds. Muscle memory. Hands that learned in field conditions where you didn't get second chances. A visiting combat medic from the 3rd Marine Division, here because the hospital hosts a quarterly medical exchange program, stands in the doorway and watches her work. His 34, name is Clayton, and he served 2 tours with Naval Hospital Support Team Fallujah. He sees something in her movements that doesn't match the scrubs or the community college nurse badge clipped to her pocket. The way she positions her body. The angle of her shoulders. The fact that she doesn't second-guess herself. That's not something you learn in a classroom. That's something you learn at night in a desert. He decides not to mention it. Some people prefer to stay invisible. Dr. Sterling arrives for morning rounds at 7:28. He's carried coffee in a ceramic mug that probably cost more than a resident makes in a week, and he moves through the pediatric unit with the particular confidence of someone who has never been told no by anyone who mattered. He's 52, Harvard Medical School, orthopedic surgery before he pivoted to pediatrics because emergency medicine pays better and requires less actual emergency. He reviews the overnight census without making eye contact with nursing staff, makes notes in the chart, and by 7:45 he's standing at the nurse's station where Laura is updating post-op vitals. His gaze moves across her the way light moves across glass, present but unseeing. New hire, he says, not quite to her. The attending, Dr. Petal, glances up and shakes his head. Bennett's been here 3 months. Community College RN program, Portland State. Competent enough for straightforward cases. Sterling nods with the slow precision of someone filing information he plans to use later. He takes a second sip of his coffee and turns to leave. Before he does, he pauses. Looks at her directly for the first time. Let's be honest, Nurse Bennett. Statistically speaking, someone with your background usually flames out by month 4. I'd give you a week. 2, if you're lucky. Then he smiles like he's told a joke and walks toward the surgical bay. The room doesn't freeze. The fluorescent lights don't flicker. Nobody gasps. Laura simply returns her attention to the vital signs on the monitor in front of her, her jaw steady, her breathing unchanged, her right hand continuing to document the numbers with the same measured precision she's been using all morning. Dr. Petal looks uncomfortable. Clayton, still standing in the doorway, makes a mental note. The kind of calm that comes after you've already survived the worst is hard to fake. That evening, Laura sits at her kitchen table in a small house on Westmoreland, and her hands are steady as she prepares her son's dinner. Michael is 10, dark-haired, and he's developed the particular sensitivity of children raised by a single parent who doesn't explain her own stories. He asks about her day in the way that means he's actually asking about her emotional state, how much of her is present at home versus how much is still somewhere else. It was quiet, she tells him, which is true. Quiet is a kind word for it. Michael eats his chicken and vegetables without complaint, but he watches her the way someone learns to watch a door. Mom, why don't you ever talk about work stuff? His voice is thin, the kind of thin that carries weight. She looks at him directly. Because the work I do is about the patient, not about me. He nods like he understands, even though he doesn't, not yet. He's 10. He shouldn't have to understand. You seem sad sometimes, he says. It's not a question. Laura feels the particular ache of having a child who is too observant, who has learned too much from a mother who isn't skilled at hiding. She reaches across the table and squeezes his hand. I'm not sad, buddy. I'm just remembering. He accepts this. Kids are good at accepting vague answers when they're delivered with tenderness. After dinner, while Michael does homework upstairs, Laura walks to her bedroom closet and moves the stack of folded scrubs that sit on the upper shelf. Beneath them, in a canvas duffel bag, are her combat boots. Desert tan, size 8, salt stains dried into the leather from 6 years of storage and 100% humidity. The laces are still threaded the way she tied them, tactical knot, took her 2 seconds to unlace them in the dark. She doesn't take them out. She doesn't touch them. She just looks at them for a moment the way people look at photographs of people they used to be. Then she covers them again and closes the closet door. The boots stay where they've been staying. Hidden. Useful. Silent. Ready. But that wasn't the worst part. The worst part was that Dr. Sterling had already begun making phone calls about whether her credentials were actually legitimate, whether a community college program really qualified someone to work in a level 1 trauma center, and whether someone with as much composure as Laura Bennett might be hiding something that ought to be flagged to hospital administration. He'd made 3 calls by the time she was putting those boots back. He'd have more answers by morning. The surgical team gathered around the nurse's station like sharks sensing blood in water. Morning rounds. 7:30 a.m. on a Tuesday. Dr. Sterling hadn't shaved. His tie hung loose at his neck, and his eyes had that particular glint that meant he'd already downed 3 espressos and was looking for something to break. Laura stood at the station updating the patient board. Her movements were precise, economical, the handwriting on the chart clean and exact. She'd learned efficiency in places where wasted motion got people killed. Now she applied it to a hospital in Portland, Oregon, where the biggest threat was usually a doctor's ego. Dr. Sterling rounded the corner with his entourage. 2 residents trailing like remoras. A medical student whose name Laura hadn't caught. The charge nurse, Margaret, who'd worked here for 23 years and had learned to smile while Dr. Sterling talked. He didn't see Laura at first. He never really saw her. He saw a community college diploma and a woman in scrubs who didn't know enough to flinch when he spoke. Morning rounds, he announced, not to anyone specific, just to the air. Then his gaze settled on Laura, and his mouth curved into something that wasn't quite a smile. Ah. Our newest addition to the team. Laura kept writing. Numbers, times, medication names. The pen moved with the same precision her hands had once used to feel dress wounds in a dismounted patrol. I'll bet $50, Dr. Sterling said, louder now, making sure the residents heard, this one quits within a week. He gestured at her the way you'd gesture at an interesting specimen in a jar. Community college nurses always do. No stamina for real medicine. They wash out by day 5 when they realize what an actual surgical team looks like. The room went quiet. Margaret's jaw tightened. The medical student looked at their shoes. Laura set down her pen. Not slowly. Not dramatically. Deliberately. She turned to face him, and her eyes met his with a kind of flat directness that made his expression falter for just a moment. "I'm here to stay, Doctor." Her voice came out like stone, smooth, impenetrable, absolute. No anger. No defensiveness. Just fact. The words had the weight of something heavier than coffee shop bravado. They had the weight of someone who'd made promises in rooms she couldn't describe to people she couldn't name, promises she'd kept. Dr. Sterling's face flushed. He wasn't used to being corrected. Correction meant he'd been wrong, and he'd spent 43 years never admitting such a thing. "Well," he said, his voice dripping with false cheer, "we'll see about that." He turned to address the residents, but something had shifted. His audience sensed it. Even his tone sounded forced now, like a broadcast that had lost its signal. The rounds continued down the corridor, his voice echoing off the tile in practiced pronouncements about medications and procedures and things Laura would do better than anyone in that hospital if she ever needed to. 24 hours later, the cafeteria smelled like chicken broth and burnt coffee. Afternoon shift change. Laura sat alone at a corner table, her tray in front of her, white bread sandwich, a bowl of soup, a juice box she'd grabbed out of habit. She wasn't reading. Wasn't scrolling through her phone. She was simply present, the way you learn to be present when presence meant survival. The footsteps came from behind. Laura heard them. Registered them. Calculated the angle and distance before anything happened. Dr. Sterling's hand made contact with her tray, and soup launched across the table in a golden arc. The bowl tumbled. The sandwich flipped. The juice box exploded against her uniform, and for one moment, the whole cafeteria went dead silent. Every staff member froze. Conversation stopped mid-sentence. Forks hovered. Even the machine seemed to pause. Dr. Sterling stood there smirking, his hand still extended as if he'd reached for something that wasn't there. "Clumsy," he said, his voice carrying just far enough to be heard by everyone pretending not to look. He walked away without waiting for a response. Because that's what bullies do. They hit and leave before the damage can talk back. Laura looked down at the wreckage on her scrubs. Soup dripped from the fabric. The juice box had hemorrhaged pink liquid across the table. She took one breath. 2. Then she stood up, crossed to the trash, and disposed of the evidence with the same methodical precision she applied to everything. No one helped. No one spoke to her. It was the kind of moment that defined hierarchies, and everyone had just learned where Laura stood in this particular pecking order. 2 hours later, at shift change, Dr. Sterling found her again. This time it was deliberate. Calculated. She was standing near the central supply station, scanning patient charts on the computer. The hallway had 6 witnesses, 4 nurses, 2 residents, all trying very hard not to watch what was about to happen. He threw the chart at her feet. Not dropped. Threw. Paper scattered across the tile like startled birds, and the chart binder cracked against the floor hard enough that someone winced. "Morrison, Emma. Age 8. Room 3B, he said, his voice pitched to Carrie. Navy brat. Father's a captain, apparently. You missed documenting her vitals, and her pre-op labs were sloppy. Chart's a mess. Clean it up, would you?" He smiled. "You did attend that community college nursing program, right? They teach documentation there? Or do they mostly teach you how to push mops?" The words landed like physical blows, designed to. They were meant to reduce her, to remake her into something smaller than she was, something that would flinch and apologize and accept the hierarchy he'd constructed. One tear escaped down Laura's cheek. Just one. She bent to gather the scattered pages, her movements careful and deliberate. Medical records were sacred. You didn't rush them. You didn't let anger make you careless with someone's health history. When she stood, she looked directly at him. And something in her eyes had changed. "I've picked up heavier things than paper, Doctor." The silence that followed had weight. It had presence. It made the fluorescent light seem louder somehow, the hum of the ventilation system more obvious. Dr. Sterling's expression shifted, confusion first, then irritation, then something closer to anger. He hadn't been prepared for her not to break. Nobody who'd ever been diminished by him had failed to break. "Well," he said, his voice tight now, "let's make sure it doesn't happen again." He walked away, and his shoulders were rigid. Tense. The residents exchanged glances. Margaret put a hand on Laura's shoulder for just a moment, the only kind of support you could offer without making things worse, and then continued with her shift. Laura stood there with Emma Morrison's chart in her hands, looking down at the document she'd filled out with such care. The vitals were immaculate. Every number correct, every notation precise, every cross-reference to Tricare billing codes in the system accurate. She'd documented the girl's medical history with the same meticulous attention to detail she'd once used to document casualty reports in places where the paperwork mattered as much as the medicine. That evening, Dr. Sterling pulled Emma Morrison's file in his office. He flipped through it twice, his jaw tightening with each page. Everything was perfect. Too perfect. No one documented like that unless they'd been trained to it, unless they understood that records were evidence and evidence was armor and liability was a weapon. He made the first call at 6:45 p.m. to Dr. Hendricks, a board member who owed him something from a golf weekend last spring. "I need a credential verification on one of our newer staff," he said. "Laura Bennett. Community college graduate. Seems a bit overqualified for a floor nurse, if you ask me. Might be worth checking her background. Could be she's misrepresenting her education." The second call came at 7. To the registrar at the community college. "I'm verifying employment credentials for one of your alumni." "Laura Bennett? She claims to have graduated in 2019. I just want to confirm the details. Routine background check." The third call, at 7:15, went to a private investigator he'd used before, a former cop named Marcus who asked very few questions and reported very thoroughly. "I need you to run a comprehensive background on someone. Full workup. Employment history, financial records, everything. Laura Bennett. Works here as a nurse. Started 3 weeks ago. Something doesn't add up, and I want to know what she's hiding." Marcus took the information without commenting. He'd been doing this work long enough to recognize a boss trying to eliminate a problem, and he'd learned not to judge the nature of the problem. That was above his pay grade. Dr. Sterling hung up the phone and leaned back in his chair. Whatever was happening with Laura Bennett, he'd get to the bottom of it. Nobody corrected him. Nobody refused to break. And nobody, especially not some community college washout with perfect documentation and eyes that didn't flinch, was going to derail his career. He didn't know what he was looking for, not exactly. But he knew it was there. You didn't document like that unless you'd been trained for consequences. You didn't respond to humiliation with stone and composure unless you'd learned it somewhere far darker than a hospital in Portland, Oregon. What happened next didn't just change everything. It set in motion a series of events that would bring federal investigators and Navy SEAL commanders into a conference room, and Dr. Sterling would spend the last year of his career wondering exactly what he'd chosen to fight against. But that night, in his office on the 7th floor of Sacred Heart, Dr. Sterling felt only victory. He'd made 3 calls. He'd have answers by morning. The doors to Sacred Heart's emergency department burst open at 3:56 p.m. on a Tuesday, and Captain James Morrison carried his 8-year-old daughter Emma as if she were made of spun glass, her small body rigid with panic, her lips the color of a bruise. The nurse at triage looked up, saw the color of her skin, and called for a stretcher before he could even speak. Emma's chest heaved. Each breath came shallow, desperate, like something inside her was drowning in air instead of water. "She's been fine," Captain Morrison said, his voice fractured. She was fine. 3 weeks ago she had her appendix out, routine surgery, she recovered perfectly, and then this morning she woke up gasping and I brought her in yesterday and they said anxiety, they said it was anxiety, and I took her home, and she got worse, and I brought her back this afternoon and they gave her medication and sent her home again, and now she can't. His hands trembled as he signed the consent forms a resident shoved toward him. His name was steady. His hands were not. Laura Bennett was restocking the medication cart on the pediatric floor when the overhead speaker crackled. Code status: pediatric patient, respiratory distress, ETA 2 minutes. She didn't look up from the labels she was organizing. The fluorescent lights hummed their mechanical song above her head. Around her, the floor hummed with the quiet efficiency of 3 p.m., post-lunch lull, shift change in 40 minutes, the children's ward ticking through its afternoon rhythms. She filed the last medication slip and moved toward the emergency stairs. By the time she reached the ER, Emma Morrison was in Bay 4, oxygen mask over her face, her father standing at the rail with his naval dress uniform still crisp from his command office, his bearing military but his eyes no longer commanding anything. They pleaded. Laura recognized that look. She had worn it once, in a different desert, under a different kind of sky. Dr. Sterling was already there, reviewing the chart with the flat effect of someone who had seen this exact scenario 17 times in the last month. Anxiety attack, he said to the resident without looking up. Hyperventilation syndrome. Classic presentation in children post-surgery, especially if the parent's anxiety is transferring to the patient. He didn't acknowledge Captain Morrison standing 3 feet away. Psychiatric consult. Then discharge with a benzodiazepine prescription and follow-up with pediatric behavioral health. The primary surgical nurse called in sick at that exact moment, a text message to the charge nurse, appendectomy backup needed in OR 2, the attending surgeon requesting her specifically, the charge nurse swearing under her breath and turning to Laura. Bennett. You've assisted on abdominal surgeries. Yes, Laura said. Appendectomy, 2 hours, now. Go change. She moved through the pre-op area the way she moved through everything, with precision that suggested purpose, with hands that knew their work before her mind had finished processing the request. The surgical scrubs were standard issue. The gloves snapped onto her hands like they had 10,000 times before. The cap covered the dark blonde hair that hadn't been cut in 6 months, wouldn't be cut until she was ready to be someone else again. Under her scrubs, against her skin, the dog tags were still there. She had learned not to leave them in lockers. Emma's appendix was inflamed but not ruptured, the surgery clean and textbook, except for the moment when the attending surgeon's hand shook slightly as he sutured, and he asked Laura to take over the closure. She didn't hesitate. Her hands moved on their own, the muscle memory of a trauma surgical team in a forward operating base overriding everything her civilian identity was supposed to be. Field expedient closure. Efficient. Economical with materials. The kind of stitching that had to hold under fire when extraction was minutes away and the nearest hospital was 12 kilometers through hostile territory. The stitch pattern was unusual. Precise but not decorative. The kind of precision that came from suturing in darkness with incoming rounds, when every movement had to count and hesitation meant death. The attending surgeon watched for 3 seconds, then stepped back and let her finish. He didn't ask questions. Some surgeons recognized the work without needing the paperwork. A combat medic from the 3rd Marine Division was visiting Sacred Heart as part of a medical education rotation, Gunnery Sergeant Marcus Breaker, call sign from his days with Charlie Company, now mentoring young Navy medical personnel. He was observing the appendectomy from the gallery above the operating theater, watching the surgical team move through their choreography, when he saw the stitch pattern. His eyes narrowed. The body language shifted. The way she held the instruments. The angle of her shoulders. The economy of movement that suggested training most civilian nurses never received. After the surgery, in the hallway outside the OR, he caught up with her as she peeled off her gloves. His voice was low, barely above a whisper, the kind of quiet that only other people trained in tactical communication could hear. Only one place you learn to stitch like that. Laura didn't stop walking. Her hands kept moving, disposing of the gloves, untying the surgical cap, each motion deliberate and controlled. When she turned to look at him, her eyes were carefully neutral, the kind of neutral that suggested everything underneath was locked down tight. Surgical rotation, she said. Military hospital. Long time ago, he said, and the respect in his voice made it clear he knew. Breaker had operated in 4 countries. He could read the language of field medicine the way other people read newspapers. He saw what was written in her hands. "I need to document the closure," Laura said, and she left him standing there. 3 weeks later, Emma Morrison returned to Sacred Heart's emergency department at 4:22 p.m., and this time her father wasn't carrying her. She was walking, but her gait was wrong, her legs uncertain, her head tilted back as if she were searching for something in the fluorescent lights above her. Her lips had the color of oxygen deprivation. Her eyes were unfocused, pupils dilated, the iris color barely visible beneath the black. "She woke up like this," Captain Morrison said to the triage nurse, his voice no longer fractured. It was controlled now, military controlled, which meant the fear had calcified into something else. "She was asleep, and when she woke up, she couldn't see properly, and she couldn't breathe, and I brought her straight here." The triage nurse checked her vitals. Oxygen saturation 92. Respiratory rate 28. Heart rate 142. The numbers wrote a story, and the triage nurse dispatched her to the main ER, 3rd bed from the door. Dr. Sterling was finishing his shift. He saw Emma's name on the board and his expression didn't change, but his jaw tightened fractionally. Another anxiety case. The same child. The same captain staring at him with those military eyes that expected answers. He pulled her chart and reviewed the previous 2 visits. Dr. Petal, anxiety attack, benzodiazepines. Dr. Chen, prescribed psychiatric referral. Dr. Womack, breathing exercises and relaxation techniques. Dr. Alvarez, anti-anxiety medication increased. 5 doctors. Same diagnosis. Same treatment plan. Same parents going home with a child who wasn't getting better because everyone was treating the panic instead of treating what was causing it. Laura was in the medication supply room 3 floors above, restocking the 4 medications after a morning surgical case, when the call came down to pediatric nursing. 3rd floor ER, respiratory distress, 8-year-old female, need assessment and monitoring. She knew who it was before she reached the bed. She knew the moment she saw the tracheal deviation, subtle, barely visible unless you were looking for it, unless you understood what you were seeing. She knew from the jugular vein distension. She knew from the decreased breath sounds on the right side of Emma's chest. She knew from the way Emma was trying to see but couldn't focus, the air hunger that had nothing to do with panic and everything to do with a lung that was collapsing under pressure, gravity and physics, and the body's physics working against itself. Tension pneumothorax. The post-operative complication that wasn't rare, just overlooked. The kind of thing that happened when a surgeon's repair held for 3 weeks and then a child's movement, running, playing, stretching wrong during sleep, created a one-way valve in the pleural space, air going in, nowhere to come back out, pressure building, pressure crushing, pressure stealing oxygen and vision and hope. Laura didn't announce herself. She moved to the bed and placed her hand on Emma's chest, pressing gently on the right side, and Emma screamed, a sound of pain that was also a sound of air pressure, of something being compressed that shouldn't be compressed, of a body in distress communicating in the only language it had left. Captain Morrison lurched forward. "What are you?" "Tracheal deviation," Laura said to the room, her voice level, informational, the voice of a nurse who had seen this and understood it. "Jugular vein distension. Decreased breath sounds right side. This is tension pneumothorax. The lung is collapsing. She's running out of time." Dr. Sterling appeared in the doorway like he had been waiting for this moment, like he had been hoping for it. He looked at Emma's blue lips, looked at Captain Morrison's desperate face, looked at Laura standing at the bedside with her hand still on the child's chest, and he smiled. "Another panic attack," he said. He didn't look at Emma. He looked at Laura. "Give her lorazepam and send her home." Emma gasped. Her eyes rolled back slightly, the white showing, the pressure inside her chest overwhelming, pushing against her lungs, against her heart, against the thin barriers between life and the alternative. Captain Morrison's hands gripped the bed rail. "Doctor, something is wrong. Something is seriously." "It's anxiety," Sterling said. His voice was level. Certain. The voice of institutional certainty. I've seen this presentation twice this week. Both cases, psychiatric evaluation, both cases, benzodiazepines, both cases, improvement within 48 hours. Your daughter is experiencing catastrophic thinking related to her surgical experience. This is a normal psychological response. Laura met his eyes. Doctor, I believe this is. Sterling cut her off without looking at her. You believe? I don't care what a community college nurse believes. Step back. He didn't raise his voice. He didn't need to. The words had the weight of institutional authority behind them, the weight of a physician's certainty, the weight of 4 previous doctors reaching the same conclusion. Prepare lorazepam. 1 milligram 4. Get the order entered now. Emma's vision was dimming. Laura could see it in the child's eyes, the fight for focus, the struggle against physical darkness, the way the lights above seemed to be fading even though they burned at full brightness. In the pediatric ward, 3 floors above, there was a crash cart. On that cart, among other equipment, there was a 14-gauge needle. The kind used for needle decompression. The kind that could convert a tension pneumothorax into a simple pneumothorax in 4 seconds, releasing the pressure, restoring the lung, restoring the oxygen, restoring the vision that was fading from a child's eyes. Emma whispered something. Her father leaned closer. What, sweetheart? What? I can't see Daddy, she said. Everything's black. Captain Morrison's face went white. He looked at Sterling. He looked at the monitor showing the vital signs spiraling lower. He looked at Laura, whose hand was still on his daughter's chest, whose eyes had gone flat and cold and absolutely certain in a way that no community college nurse should ever look. Sterling was already walking toward the medication dispenser to enter the lorazepam order, his back to the room, his attention already moving toward discharge paperwork and the end of his shift. The medication would be here in 90 seconds. In 95 seconds, Emma Morrison would lose consciousness. In 120 seconds, her heart would stop. Laura did the only thing she could do. She let go of Emma's chest, turned away from the bed, and she moved. Emma's lips were already losing their color. Pale. Then blue-gray. The pulse ox had started its death song, beeping faster with each drop in oxygen saturation. 78. 72. 68. Around her, 5 doctors stood frozen, Sterling, Petal, Womack, Chen, and Alvarez, all of them convinced they'd already solved the puzzle. Anxiety. Hyperventilation. A child having a panic attack. But Laura had been in operating rooms where the difference between life and death came down to reading the space between one breath and the next. She saw it now. The subtle deviation in Emma's neck. The trachea wasn't centered where it should be. It had shifted. Shifted meant pressure. Pressure meant suffocation in real time. Laura didn't hesitate. She didn't ask permission. She moved. Hand steady as a surgeon's laser, she grabbed a 14-gauge angiocath needle from the crash cart, muscle memory older than her civilian license taking over, and positioned it at Emma's chest wall. Second intercostal space. Midclavicular line. The anatomy was the same whether you were doing this in a hospital bay or in a concrete bunker south of Baghdad. The principle was identical: release the pressure or the patient dies. Sterling's voice came from somewhere behind her, sharp and incredulous. What the hell do you think you're? But Laura was already pushing the needle through the chest wall. Skin. Fascia. Pleural space. She felt the give, that singular moment when the resistance changed. Then came the sound that meant salvation. The hiss of escaping air. Trap pressure releasing like a tire blowout in miniature. Emma gasped, real breathing, not the tortured half-gasps of a child drowning in her own pneumothorax. Color came back to her lips in seconds. Pink bloomed across her cheeks. Her eyes widened. Focus returned. Daddy, Emma said, her voice steady and clear, I can see you. Captain Morrison had gone pale watching his daughter disappear. Now he staggered backward, hand over his mouth, tears running down his face. The ER went so quiet you could hear the ventilator in the adjacent bay cycling, the subtle electronic hum of every machine suddenly audible. Laura had already removed the needle. She was bagging Emma's oxygen, checking the monitor. O2 sat climbing. 84. 90. 93. Stable. The child was stable because Laura had done what the 5 doctors had missed, had read the body's language and responded in the dialect of crisis. Dr. Sterling's face went through a transformation like time-lapse photography. First white, the kind of white that comes from witnessing your own narrative collapse. Then red. Not blushed red. Angry red. The color of a man realizing his authority had just been overridden by someone he'd spent weeks trying to minimize. His jaw clenched so hard the muscles worked visibly. He stepped toward Laura, his voice low and controlled in that way that meant worse things were coming. You just performed an invasive procedure without physician authorization. Without a single order. You're done. Finished. The words weren't loud. That was worse than if they'd been screamed. Quiet destruction always was. Laura met his eyes for exactly 1 second, long enough for him to see there was no remorse there, no apology, no doubt. Then she turned back to Emma to ensure the child's airway stayed open. Within the hour, Sterling had made 6 phone calls. 3 to board members. 1 to the chief of staff. 1 to hospital legal. 1 to an external medical review consultant. He painted the narrative with precision and poison, a community college nurse performing emergency invasive procedures without authorization, circumventing the entire chain of command, acting out a savior fantasy that endangered the patient's legal standing in litigation and the hospital's regulatory compliance. He didn't mention that Emma Morrison was breathing because of that needle. He didn't mention that 5 doctors had missed the diagnosis completely. He mentioned only that a nurse with a community college degree had committed what amounted to assault with a medical instrument. By 3 o'clock that afternoon, the hospital's legal department had issued a cease and desist on Laura's clinical duties. By 4, she was summoned to the administrative offices on the 7th floor. The administrator's office looked like every administrator's office. Neutral artwork. A desk so clean it looked ceremonial. A woman named Reeves, someone from Human Resources who'd clearly been trained to deliver bad news without inflection, handed Laura a single sheet of paper. Effective immediately, you're placed on administrative leave pending a full investigation into scope of practice violations and reckless conduct. Reeves' voice had that practice gentleness that made termination sound like a gift. You'll need to surrender your badge and access credentials. Laura took the paper. Her hands were steady. She unscripted her employee badge, the one that had cost her 3 weeks of humiliation and 2 years of quiet survival, and placed it on the desk next to the letter. You can call my attorney tomorrow if you need to schedule a follow-up meeting. Reeves' eyebrows moved slightly. That wasn't the response people usually gave. Most people cried. Most people protested. Most people treated the moment like the end of something. Laura simply turned and walked out. Her composure was a weapon, and she'd learned long ago not to reveal the damage to an enemy. The Portland rain had started by the time she left the hospital, the kind of cold October downpour that came sideways. She didn't put up her hood. The rain felt like something real, something that matched the hollowing out happening in her chest. She drove home mechanically, traffic lights registering in her peripheral vision but not in any conscious part of her mind. The apartment was dark when she arrived. Her 10-year-old son, Marcus, was at his after-school program. She had 3 hours alone before he returned. 3 hours to feel whatever was coming. Laura sat at the kitchen table still wearing her scrubs. The fabric was damp from rain and sweat and the accumulated weight of decisions made in trauma bays. She'd saved a child's life this afternoon. And lost everything doing it. That was the equation nobody told you about. That was the math that didn't balance. She opened the closet in her bedroom, the one Marcus wasn't supposed to look in, and pulled down the plastic storage container she'd hidden on the highest shelf 6 years ago. Inside were the boots. worn down combat boots with the toe scuffed from rappelling line. The leather was cracked in specific places, across the arch where she'd marched 14 kilometers, across the heel where dust had worked its way in during a sandstorm outside Eldora. The boots smelled like desert and oil and a version of herself she'd been told to bury. She sat at the kitchen table with those boots in front of her, still in her scrubs, and she sobbed. Not quietly. Not with restraint. Not with the composure that had carried her through 2 decades of violence and 6 years of invisibility. She put her head in her hands and she broke. The senior chief petty officer, the woman who'd carried wounded soldiers through gunfire, who'd stabilized patients with no equipment but trauma, shears and intention, who'd had her entire existence classified and redacted, came apart at the seams because she'd finally found something worth dying for, and they'd made her choose between saving the child and keeping her name. Marcus found her like that when he came home from after-school care. His mother, who'd never been fragile, who'd never cried in front of him, who'd taught him that resilience was a kind of religion, sitting at the kitchen table in her hospital scrubs with combat boots in front of her and tears running down her face. Mom. His voice was small. The voice of a child who'd just discovered that adults were as breakable as everyone else. Why are you home? You said you were working until 7. Laura couldn't answer. She reached for him and pulled him close, and he held her without understanding why. But he understood something. Understood that his mother had been fighting a war he couldn't see, against an enemy he couldn't identify. The official story, the one filed away in classified documents 6 years ago, was that Senior Chief Petty Officer Laura Bennett had died in a training accident in 2018. Died. Gone. Erased from every database except the ones only 3 people in the country could access. The woman who'd walked out of that debriefing room in Virginia had been given a new social security number, a new driver's license, new paperwork that identified her as Laura Bennett, nurse. Not senior chief. Not officer. Just Laura. A woman with no military history, no combat record, no medals or citations or proof of anything she'd survived. That woman had been told to disappear, to never surface, to become no one. To forget the war. To forget the operations. To forget the 14 people she'd pulled out of burning buildings and kept alive with hands that knew exactly where to push, exactly where to cut, exactly where to pour her own blood into someone else's open chest cavity if that's what survival required. But nobody forgets those things. They just live underneath like shrapnel. Monday morning arrived with the kind of stillness that precedes everything changing. The ER doors hissed open at 7:43, and a man in his early 50s shuffled through, clutching his chest, his breathing shallow and measured like someone counting seconds between heartbeats. Samir al-Rashid. Chest pain. Routine admission. Laura was at the vital station when she looked up to attach the pulse oximeter, and the world stopped moving. The man's eyes widened. Not with pain. With recognition. "You are the woman who carried me for kilometers under fire in Eldora," he said in accented English, his voice carrying the weight of 17 years compressed into a single sentence. Laura's hands went still. The pulse oximeter dangled from her fingers. Around her, the morning ER rhythm continued, monitors beeping their electronic pulse, residents reviewing charts, orderlies pushing empty stretchers, but in her small corner of Sacred Heart, time had fractured. She had spent 6 years being told that woman was dead. That Senior Chief Petty Officer Laura Bennett had perished in a training accident in 2018, buried in classified paperwork, erased from every database except one vault in the Pentagon. But Samir al-Rashid stood in front of her, breathing, alive, and he knew. He knew. "Your vitals, sir," she said quietly, her voice steady as surgical steel, but her hands trembled as she reached for his wrist. Not fear. Muscle memory. The same tremor that came before contact, before extraction, before the world became very simple and very immediate. Captain Morrison was still in the waiting area. Emma sat beside him, her restored vision following her father's movements with perfect clarity, the vision Laura had saved when 5 doctors had missed a tension pneumothorax that was crushing her daughter's lung. Morrison stood slowly as the ER staff began moving around Samir, the captain's movements deliberate, purposeful, the kind of stillness that comes from military discipline meeting fatherhood. His daughter's hand was still in his. He walked to where Laura stood, attaching the cardiac monitor to Samir's chest. "What rank?" Morrison asked. Not a greeting. A statement. A question that required only one answer. The room went dead silent. Residents froze mid-charting. A nurse stopped pushing a crash cart. The only sound was the monitor strip printing its paper rhythm, spooling out like a confession. Laura's voice dropped lower than anyone in that ER had heard it before. I served as a hospital corpsman, sir." And in those 8 words, every carefully constructed wall came down. Her eyes met Morrison's, and something in that gaze, something in the precision of her stance, the way her shoulders had squared with the question, the measured authority of those 8 words, told him everything he needed to know. Within 20 minutes, the hospital conference room was full. Not with administrators called by email. With people who appeared. A Navy SEAL commander in dress blues, his shoulder boards catching the fluorescent light like military insignia worn to court. 2 FBI agents, one of them introducing herself as Special Agent Carr. A uniformed Navy JG officer. The hospital board chair, looking bewildered. Dr. Sterling, who had heard rumors and shown up to protect his territory, standing at the back of the room with his jaw clenched so tightly the muscle was visible from across the table. The SEAL commander, call sign breaker, 30-year career, command presence like a Humvee idling in a quiet garage, stepped forward. His voice was precise, formal, the way Navy officers sound when delivering testimony that has already been written in the official record. Senior Chief Petty Officer Laura Bennett received 2 Bronze Stars with valor. He paused. The room absorbed this. Bronze Stars. 2 of them. Silver Star for actions during Operation Mountain Storm. Another pause, longer this time. Everyone understood, each medal was a life saved, a choice made, a moment where she had stepped forward when stepping back was infinitely easier. 2 Purple Hearts. Morrison's hand found Emma's shoulder. The child's eyes widened. Her hero, the quiet nurse in the blue scrubs, had been shot. Twice. And the Navy Cross. The silence after those 4 words was so complete you could hear the rain beginning to fall outside the conference room windows, drumming against the glass like Morse code spelling out a secret finally being told. The Navy Cross. 3rd highest decoration. For valor in combat. For leadership? For the kind of courage that gets people killed or written into history books. For actions that saved 14 lives during an operation that officially never happened, Breaker continued, and his eyes found Laura's across the table. When he looked away, there were tears on his weathered face. "We thought we'd lost you in Eldora." Dr. Sterling's mouth opened. He looked around the room as if searching for an ally, someone to validate that this was impossible, that the quiet nurse he'd publicly humiliated, the community college hire he'd thrown paperwork at, the woman he'd successfully isolated and suspended could not possibly be the decorated veteran now being acknowledged by the United States Navy. "I'm Special Agent Carr, FBI Financial Crimes," the woman in the dark suit said, and her voice cut through the room like a scalpel through tissue. She didn't look at Sterling. "Not yet. Dr. Sterling, you're under investigation for defrauding military healthcare to the tune of $1.2 million. The numbers landed like artillery rounds. 1.2 million. The amount was so large the specificity made it real in a way round numbers never could. Our preliminary investigation began 6 weeks ago following irregularities reported by hospital administration, Carr continued. She opened a folder. Inside were Laura's charts, meticulous, precise, documented with the kind of attention to detail that only came from someone trained to notice when protocols were violated, when patterns emerged, when the math no longer added up. Billing codes for consultations on active duty dependents who were never seen by you. Procedure upgrades coded as complex cases when they were routine. Follow-up appointments billed for patients who had been discharged from the hospital. She looked directly at Sterling now. You maintained these false billing patterns for 22 months. You submitted claims through TRICARE insurance. Military families paid out-of-pocket costs because of insurance denials based on your fraudulent coding. And when a nurse with military training, began reviewing patient histories and noticed the inconsistencies, you attempted to discredit her by launching a background investigation, contacting her former employers, and fabricating complaints about her clinical competence. Sterling's face had gone from red to a color that wasn't quite human. His hands clenched into fists at his sides. "Unfortunately for you," Carr said, and her tone suggested she had said this line many times and enjoyed it every single time. Contacting this particular nurse's former employers triggered automated alerts in the Defense Intelligence Agency. When a private investigator you hired began asking questions about a senior chief petty officer Laura Bennett, deceased 2018, a Pentagon liaison flagged the inquiry. This investigation was already underway. Your attempts to eliminate her accelerated your exposure by 47 days. The hospital board chair stood, her face a mask of controlled fury. "Dr. Marcus Sterling, you are terminated effective immediately for fraud, patient endangerment through delayed diagnosis, and attempting to silence a whistleblower through retaliatory administrative action." She turned to security, already waiting by the door. "Please escort Dr. Sterling from the building." What happened next had the quality of theater that only happens when power is redistributed in the span of 3 minutes. Dr. Sterling, the man who had held this hospital like a fiefdom for 14 years, who had made junior residents fear his name, who had thrown patient charts at a woman he didn't recognize, walked toward the exit with security flanking him. His jaw trembled. His eyes were still looking for someone to validate that this was wrong, that he deserved to be here, that the world still followed his rules. The corridor from the conference room to the hospital exit ran past the main lobby. Every staff member working that shift seemed to materialize as Sterling walked that hallway. Laura watched from the conference room doorway. Morrison stood beside her, Emma's hand in his. Staff Sergeant Rodriguez, the combat medic who had recognized Laura's suturing technique on Emma's appendectomy, started clapping. Single, measured claps, like a drumbeat. Captain Morrison joined. Then a resident. Then 2 nurses. Then orderlies and phlebotomists and respiratory therapists and security guards, people who worked 16-hour shifts for wages that didn't match their skill, people who had no power in this hospital except the power to witness, the power to acknowledge when someone was being seen, being recognized, being honored. The applause grew until it echoed off the tiles. Sterling didn't look back. Laura stood motionless. One measured breath. Her hands were steady. Her spine was straight. The tremor was gone. What remained was the thing that had always been underneath, the discipline, the training, the composure that comes from having already survived the worst and walked toward it anyway. Commander Breaker approached her. His uniform seemed to carry its own weight, its own authority. "The Navy would like to discuss your return to active duty, Senior Chief. We need people like you," he said quietly, and the words carried the weight of classified files being reopened, of the Pentagon's paperwork being rewritten, of a woman being asked to reclaim a life she'd been told to discard. Laura glanced at her 10-year-old son, waiting by the waiting area door. He was watching her with the expression of someone who suddenly understood that his mother was not what he had thought she was. That she was bigger than he had known. That the quiet woman who made sure his lunch was packed and checked his homework was also the woman who had carried strangers through fire. "I'm needed here, sir," she said. "But thank you." 6 months later, the Navy formally acknowledged her service in a ceremony at Sacred Heart. The official record was amended. The classified files were unsealed, not entirely, not enough to compromise active operations, but enough that Laura Bennett existed again in the database. Enough that she was no longer dead. That evening, after the ceremony, after the medal presentations, after the photographers had left, Laura sat on her front porch while her son played in the yard, and she reached into her closet. The worn combat boots came out. She placed them on a shelf in the living room beside her nursing school diploma and a framed Navy Cross citation. The picture showed her, 23 years old, receiving the medal from an admiral whose name had been redacted in the approved for-release version. But she was there. It was proof. It was real. 3 weeks after that, Laura walked past a strip mall on her way to the grocery store. The afternoon was clear, the kind of Portland autumn that smelled like rain coming and pine trees standing up against it. Under a banner reading Discount Auto Insurance, Best Rates, a man sat at a folding table, shuffling pamphlets with the mechanical precision of someone going through the motions. Dr. Marcus Sterling. His hair had gone more grey. His suit was wrinkled. He looked up as she passed, their eyes meeting for exactly 1 second, and then he looked away first. He looked away first. Laura continued walking without changing pace, without acknowledgement, without the satisfaction of reaction. She had learned long ago that the most devastating response to someone who had tried to destroy you was indifference. He was no longer worth her attention. He was just a man at a folding table. At Sacred Heart, Emma Morrison's vision, perfect now, restored by the needle decompression Laura had performed before the pressure in the child's chest could cause permanent brain damage from oxygen deprivation, allowed her to see clearly as she ran through the pediatric unit to the nurse's station. Laura was checking patient charts when Emma appeared, holding a drawing. It was a stick figure in blue scrubs. It had combat boots. It had a cape. It had a stethoscope. "That's you, Nurse Bennett," Emma said, her voice carrying the absolute certainty of a child who had learned that heroes were real and stood in hospitals and saved your life when doctors got it wrong. "You're my hero." Laura knelt down, and for the first time in 6 years, she let herself be seen exactly as she was. She placed one hand on Emma's shoulder, and her voice carried the weight of everything: the operations, the scars, the time underground, the woman she had been forced to kill in order to survive, the person she had chosen to become instead. "Heroes come in all forms, sweetheart," she said. Captain Morrison extended his hand that evening. The handshake was firm, military, the kind of acknowledgement that happened between people who understood what it meant to carry weight that couldn't be set down. "Thank you for seeing what others missed. For having the courage to act," Morrison said. "Your daughter would have lost her vision permanently," Laura replied. The pressure was against the optic nerve. 5 more minutes without decompression and there would have been permanent brain damage. "I did what was necessary." "No," Morrison said. "You did what was right. There's a difference." That night, as Laura's son played video games in the living room and the autumn rain drummed against the windows, Laura sat in the kitchen and opened her laptop. She pulled up her nursing school application from 16 years ago, the backup plan she'd created as cover story. She'd been taking online classes since the suspension lifted, working toward her bachelor's in nursing science. She submitted her application for the graduate program. The Navy had offered reinstatement. Sacred Heart had offered her choice of any position in the hospital. But what she'd learned over 6 years of being no one was that power existed in multiple forms. A title was one kind. Knowledge was another. Patience was another. The ability to see what others missed, to notice patterns, to act when action mattered most, that was power that no institutional force could take away because it lived inside you. It had been forged in fire and tested in blood and carried in the muscle memory of hands that had held other people's lives together. She would stay at Sacred Heart. She would complete her degree. She would train the next generation of nurses to see, to question, to act with precision and purpose. And the worn combat boots would stay on that shelf, not hidden anymore, not a secret, not a piece of evidence of a life that was supposed to be erased. They would be a reminder. The next morning, at 7:45 a.m., Laura walked into Sacred Heart wearing fresh scrubs and a stethoscope. Staff Sergeant Rodriguez passed her in the corridor and gave her a crisp nod of respect, the kind of acknowledgement that needed no words. At the nurse's station, she opened the patient charts for her shift. The same meticulous attention. The same precision. The same quiet authority that noticed everything and said nothing until it was time to act. If you've ever worked somewhere that didn't see your value, or you've witnessed someone being underestimated, share your story in the comments. And if you found this story about hidden strength and quiet heroism worth your time, please like, subscribe, and hit that notification bell so you never miss another video about the people who change everything while the world watches. Your support means everything. Thank you for being here.